are you wanting to have a hair transplant and want to have a natural result? Then you probably need to see this video. I'm Dr. Mazhar Hussain. Please subscribe to our channel and click the notification bell so that you're updated with our videos. So what I believe is the most important thing when having a hair transplant is actually having a natural hair transplant. Many patients are focused on the number of grafts you can take, the price and so on. But ultimately what really matters is that you get a natural transplant. So before we go into the natural transplant, let's talk about what can cause unnatural transplants. An inappropriate hairline for the age can look quite odd. It could also be a hairline that looks fine at 27 years of age, may look odd at 45 years of age. It could also be that you're not able to maintain that hairline because your hair loss progresses so rapidly and changes with time. So even though you put a hairline that may be appropriate for age 40, you may not be able to sustain it due to further hair loss. A straight hairline is a giveaway that is a transplant. If you have 3 or 4 hair grafts, especially if you have thick hair and you have 3 and 4 hair grafts in the hairline, again, it will show that it's probably a transplant. Wrong 3D direction, this cannot be stressed enough. It's very common for many clinics to go for 90 degrees direction, which makes it easier and faster to implant and you can get rid of the surgery faster. But it also shows that it's a transplant. The job was done quite fast. Graft distribution is important. How do you get the best appearance of density with the same grafts? Where do you use the singles, doubles, triples and so on? If the hairs are placed too precise with the exact same distance from graft to graft to graft, it may also look transplanted. You can have something called pitting. You can have cobblestoning. There are other issues that you can have in the recipient area which may give away that this is probably a transplant. So this was about the unnatural results. We have a separate video on this and you're of course welcome to watch that video. If you look at how to get a natural result, it's important that we take a number of things into account so that we don't just treat every patient equally the same and say, okay, this is how we do it and this is how we'll do it with you. We need to look at the age, we need to look at the present age, and we also need to look at how will this hairline, how will this hair also be on the hairline, how will this look in another 3 years, 5 years and 20 years? Will it look natural or would it start bothering the patient? We need to take into account the race. We may not have the same suggestions for two different people with different ethnic backgrounds. Sex is important. If you are male or female, the hairline has to be done accordingly. Female hairlines are quite different from male hairlines, and male hairlines of course are different from male to male, from person to person. We need to take the shape of the face and the head into account and look at the recipient area otherwise also. There can be reasons why we might need to adjust the design that we might have done otherwise. For instance, say if someone has a scar, we may need to cover that scar in that transplant and it may mean we will lower the hairline just a bit maybe, or maybe widen the front to cover some scars in the temples. There can be other reasons that we will take the recipient area itself into account. Of course, it's, as I mentioned, super important with the 3D direction. It's not just right back and forth direction or side to side direction. We also need to look at what depth we are going into and we need, of course, to take into account the donor availability. It's not hard to do a very high density transplant for a limited area at age 25 because there's some receding hairlines. But if that is too dense and say 5 years later, 8 years later, the patient goes completely bald, he may not have enough donor area to keep the same density in the remaining areas, which means that it will look odd even if you do another 2 or 3 transplants, simply because we spend too many grafts in the donor, in the temples, and later on we are not able to have the same kind of results in the remaining areas. If we look at the recipient area itself and only the recipient area, things that we would want to consider, there are much more than this. We need to consider where are we working. The direction will be different in the temples and the temporal point. The hairline is different. The temporal point changes direction for every few millimeters. The mid-scalp has more or less the same pattern within that area. The crown changes everywhere. There is exactly every few millimeters you would want to adjust the direction of the grafts that you're placing in the crown. Eyebrows, it's super important to know how to get the correct direction in the eyebrows. And honestly speaking, it's very hard actually to get a proper, good, nice, good density, natural looking eyebrows. So I usually explain to my patients that I may not be able to give a completely natural result with the eyebrows. However, with the head, we can get supernatural results. People won't even notice that it's a transplant. Moustache and beard is easier to do than the eyebrows, and we can get super nice natural results. So I would say from all of these recipient areas, I would probably say that the toughest time I have is with the eyebrows. I have some difficulty reaching there. If the patient has really poor eyebrows and the baseline is really bad, in that case, I might say to the patient, look, we may not get a natural result, but from where you are today, we can do a super improvement. If someone is wanting to adjust slightly on something that is actually quite good already, if it's quite good already, the baseline is good, the starting point is good, I would be more inclined to tell the patient, look, I don't think that we will be able to get such a natural result that you want. I had a colleague who had actually quite nice eyebrows, and she wanted to have, she's a dermatologist, she wanted to have thicker eyebrows because she felt it was more appropriate for her situation right now. And I would happily have done it, but I told her, look, from your starting point, you have completely natural eyebrows. They look nice, good, everything's fine. We could make them wider, but chances are you will not actually be happy. I already did a hair transplant for her for the hairline, but with the eyebrows, I told her that with this starting point, with this baseline, if this is what you have today, we better not touch it. You have to understand that we may not be able to get something that you'll be super happy about. So from all of these, the most trouble I have is with the eyebrows. Otherwise, we can get super nice results, supernatural results, and quite consistently supernatural results. So it's quite okay. So if you look at this is a Danish artist from Denmark, and he had a receding hairline, high temples, and you can't really tell that he had a transplant. Same here, you see the side view. Even his hairdresser from Copenhagen Spa, this patient, Michael Milby, actually asked the hairdresser, can you check if there's anything wrong with my hair? And he tried to look for something. He couldn't find anything with the donor area, he couldn't find anything with the recipient area. And then he told him, look, I actually had a transplant. And the hairdresser from Copenhagen Spa actually came to my clinic just to see what I was doing and how I was doing it. So this is these are three brothers from Glasgow. They've been here for hair transplantation with me, and one of them is this guy. Again, naturalness is what really is important. So this concludes our video on natural results. Do click the notification bell, do subscribe to our channel so that you're updated with our videos. Thank you for now.